Hey guys, and welcome back to XL Medical Spa, and here's another YouTube episode on aesthetics. So today what I want to talk about is more of the global picture. So what do I have in my toolbox, and how do I use those tools in that toolbox to really get you to your goals when we come back? So when I first meet you, we always go through a comprehensive health history and a comprehensive conversation on what your goals truly are. And sometimes, or actually a lot of times, I get these conversations where the patient doesn't know what they need, don't know what they need. So the thing is, we start looking older and we start looking a little more tired, but we don't know why. So much like when people start getting work done, we're like, they look a little bit better, but we don't know why. That's kind of the goal. So some of the things that make us look older or a little bit more aged is pigment, texture, volume loss, and laxity. We've talked about these things over and over on different episodes, but today, how do I use certain tools in the toolbox to address certain things? So the most common tool, or the one we use the most of, is Botox. Now, not everyone wants to use this. Some people always have that fear of putting a toxin into their body, and I understand that fear, but if we want to address wrinkles, we have to minimize the emotions that cause the wrinkles. So this is why I have so many wrinkles, because I try to give examples of this. So if you look at my frown, every time we frown, we create these 11s, the 111s, or the frown line straight in the middle. We have to actually physically frown or squint to make that wrinkle. If you went throughout your whole life with ever frowning, then you would never make that wrinkle. But the first step in trying to correct or even improve on wrinkles is minimizing the cause. So we smile, crow's feet, we lift our eyebrows, forehead wrinkles. So those are the three common areas that we treat. So remember, you have to stop the cause before you ever treat the symptoms. So if you come to me and you say, hey, why don't we just put some fillers into it? Why don't you just put some threads into it? Two parts. One, if you just fill it or you just put threads into it, again, you're not fixing the cause. Rather than just addressing the symptom, why don't we fix the actual cause of the problem? The other part is if I put fillers into these wrinkles and you still have movement like this, what will happen is the filler will just get pushed out of those wrinkles. The other part is it a dangerous place to fill? This track right here up the middle of the nose, I don't fill. I use other procedures such as threads, but if you can imagine, if I put threads right into that wrinkle, or if I put filler right into that wrinkle, one, it's dangerous for the filler, but two, if I put threads here and you still have that frown or you still have the mobility up in this area, you'll just push the threads right out of that area. Now, when it comes to Botox, I like to use that as prevention, but I also like to use it for correction as well. So when should you start doing it, at what age? For me, it's not really necessarily what chronological age you are. Granted, I want you to 18 and above, but what skin age are you? Are you a surfer? Are you a sunbather? Are you an office worker that never sees the sun? So you could be a 40, 50-year-old and have better skin than an 18, 19, 20-year-old who just sunbathes and surfs all day long. So I really want to see what skin age you are and how animated you are. So if you lift your eyebrows or if you frown, but at rest, at static rest, if you don't see the wrinkles, then you don't really necessarily treat it. But if you're at rest and you see crow's feet and you see forehead wrinkles or anything wrinkles like that, that's when I think it's a good time to start Botox. So before it gets ingrained, before it gets any deeper and we're trying to fully correct it with lasers, fillers, and threads, just the fact that you're consistent with Botox every 3 to 4 months, if you stop making those wrinkles, depending on your age, depending on your lifestyle, your body will actually correct those wrinkles quite well. Now, the next part of the aging process, and I learned this from a plastic surgeon up in LA, I really like these terms. He says descension and deflation. For me, I talk about volume loss, where it makes your skin fall forward and down. But those two words of descension and deflation, I really, really like. So what does deflation mean? It means that over time, we lose bone, we lose fat, we lose muscle, and a bunch of other things that make us lose volume. So if you lose volume in the cheeks, you lose volume in your jawline, you lose volume in your lips, all you have left over is skin, and that skin begins to fall forward and down. So how do you treat deflation or volume loss? You have to put volume back in. And this is where fillers comes in. So please click that link in the description or above here as well in regards to people's fear about looking fake and artificial. But one of the terms or one of the sayings I use quite often is, if age takes volume away from you, put back just enough so it looks like you. If you want to go past that and start altering the way you look, sure, we can talk about that. But if your fear is looking, again, fake, hate that word, but if your fear is changing the way you look too much, then just put in the right amount of volume. So you anti-age, put in a little bit, come back to me in a month or two, and we can add more, and more. To ever get to that phase where you personally or someone else personally thinks you're getting too much work done, it's a ton of fillers. It's a lot of syringes, and also it's how you place it as well. Let's assume you don't have a natural cheekbone, or your cheekbones are lower set. If I go outside of your anatomy and try to give you these super high pronounced cheekbones, that's changing the way you look. However, when I usually fill, I follow your natural anatomy. So we feel for your cheekbones, we feel for your jawline. Whatever volume loss or deficit you have, we're just putting back that volume where it belongs. And that's why fillers is such an important tool to how we anti-age. We talked about Botox, that's for wrinkles. Fillers, that can be either for volume, and in some places you can treat it for wrinkles as well. Again, this frown line, I don't personally treat that wrinkle with fillers, but some other practices do. Smile lines, this isn't necessarily volume loss. What happens is we lose cheek support, so our skin falls forward. So you'll hear me talk about this in previous videos, but you usually treat the mid-face and the cheeks first to lift this area, then we'll come into the smile lines, we'll come into the marionette to blend this area. So we're replacing volume, yes, but that filler aspect can also help lift skin. So filler number 2 is a very important tool in that toolbox I use to help you anti-age. Now the last tool I have here at EXO is PDO Threads. So we've talked about wrinkles, Botox, we've talked about fillers, which replaces volume, but then we also can lift with fillers if we put volume into the right place. Now at some point, myself or you will say there's plenty of volume, I can't handle anymore, but how do I continue to lift the laxity? So the third part of the aging process that we talked about is collagen loss, and then we talked about just dissension. So how do I physically lift or approximate tissue on different part of the bodies without adding volume? And this is where PDO Threads comes in. You guys love when I talk about PDO Threads, but we don't necessarily always understand what it can do. So PDO Threads, what we're doing is lifting without producing any volume, and then also improving skin quality, such as that collagen production. Now, one of the fears that comes with PDO Threads is it's the unknown. But the best way you can think about it is fillers. I'm putting in a product, a medication. With PDO Threads, I'm putting in a product, a thread into your body. So it's the same mechanism. We're just putting something into your body, but it's doing something different. And then the other piece is people always have that fear of, I don't want to look stretched. I don't want to look like I've been windswept. And PDO Threads will never do that. To get that extensive of a lift is surgery. PDO Threads, and you guys will hear this in multiple videos, is if you put your finger anywhere on your body and you can give yourself a 1-finger lift and it doesn't create a mound of tissue behind here, then PDO Threads is a good option. If you had to physically lift your body with your whole palm or multiple fingers, chances are that's a more surgical result that you're looking for. But PDO Threads, why I love it so much is, one, you get this long-term production of collagen, you get this tightening of skin, you also help with wrinkles, but more importantly, it gives you that satisfaction of giving that mechanical lift that not any other procedure I can think of gives you. So to recap, those are the 3 main tools that I have in my toolbox at my disposal here at EXO. We can talk about texture, we can talk about pigment another time, but that's usually lasers, resurfacing, microneedling, things like that. But when it comes to anti-aging, those are the main things that people want to reduce is wrinkles, volume loss, and laxity. So for wrinkles, we're using Botox. For lifting a little bit, and for especially volume loss, you have to use fillers. And lastly, to lift, to tighten, to improve collagen without causing any volume is PDO Threads. So it's never one thing that corrects everything. So when you come to us, we always talk about goals. What is your number 1 goal? What's your number 2? What's your number 3? And so on and so forth. Some people will come in with a whole laundry list of goals. And sometimes we can get lost in the conversation. It can get washed out in regards to what you want to do because we can't do everything at once. So try to figure out your main goal. Is it your wrinkles? Is it your volume loss? Is it just a general lifting? And then we can come up with a game plan together. But you can see within that toolbox, we really want to use the right screwdriver, the right hammer, the right procedure to correct what your personal goals are. All right, guys, so that is another episode of XO Medical Spa. I hope you found that very educational. Again, if you truly like these videos and it helped you, please give it a thumbs up. It helps your algorithm, so you'll get more videos like this, so you can become fully educated either to us or to another practice. And then also subscribe as well. It also pushes this video all out to everyone else, so people who are looking for these educational pieces will help find these helpful as well, okay? So thank you again for joining another episode of XO Medical Spa. Take care. I'll see you guys on the next episode.